Everyone, and welcome to today's webinar on direct certification best practices. My name is Allison Perez, as Nomi said, and I am a child nutrition policy analyst with the Food Research and Action Center, or FRAC. Thank you so much for joining us for today's conversation. We know how busy everyone is, and we really appreciate your interest and participation. We wanted to host this webinar because we know that with uncertainty around what next school year is going to look like, it's never too early to start thinking about direct certification to enhance access to the school meal programs for low-income students. As school districts prepare for their nutrition operations for 2022-2023 next year, now is the time to revisit the importance of direct certification. Direct certification is a key tool to allowing schools to increase the number of students they certify to receive free meals without submitting an application. As school nutrition programs return to normal, strong direct certification can help schools by improving financial viability of community eligibility, reducing administrative work, and ensuring access to free school meals for the most vulnerable students. The goal of this webinar is to provide strategies and best practices for successful direct certification operations, to hear from speakers about their best practices, and to answer any questions you guys have. Next slide. We have a full agenda today with great speakers, so now I would like to go over the schedule for our webinar. First, I am going to give a brief overview of direct certification. And next, I'm really excited to hear from a representative from USDA and a state director about direct certification. First, we have Joseph Templin, who is a program analyst for the child nutrition programs at USDA's Food and Nutrition Service. And next, we will hear from Robert Leschen, who's the director of the Office for Food and Nutrition Programs at the Massachusetts Department of Elementary and Secondary Education. I will then go over a couple of quick resources on direct certification available from FRAC, which will be followed by our Q&A session. We'll be saving questions for the end, but please feel free to use the Q&A function on your screen to ask questions at any time throughout the webinar. Next slide. Direct certification is an electronic process of data matching that allows children who are categorically eligible for free school meals to automatically receive free meals at school without submitting a school meal application. Any child belonging to a household that participates in SNAP, TANF, FDPR, Medicaid, which is only available in some states, or children who are migrant, homeless, or in foster care or Head Start are categorically eligible to receive free meals at school. Children who are categorically eligible for free meals can be directly certified to receive free meals at school without submitting a school meals application to determine their income eligibility. Before direct certification, children were determined eligible for free reduced price meals through submitting a school meal application form to the school. Direct certification replaces this process for many children by identifying those who are categorically eligible. And qualifying assistance programs have already checked household income, which eliminates the need for households to submit income information on the school meal applications and for schools to process these applications. Efficient and reliable direct certification systems more accurately reflect the poverty in the school, allowing more high poverty schools to qualify for community eligibility. States and school districts can take more steps to improve their direct certification systems, resulting in more students receiving the nutritious school meals they need to support their health and learning. Next slide. And to learn more about this process of direct certification and the steps taken to improve it, I'd like to enthusiastically turn it over to our first speaker. Joseph Templin is a program analyst for the child nutrition programs at USDA's Food and Nutrition Service. Take it away, Joe.
Thanks, Allison, and thanks for this opportunity to speak to a large audience on the importance of direct certification as we move forward for both this current year and for next school year. Over the last couple of years, direct certification has, for understandable reasons, decreased in priority and importance as state and local staff have dealt with pandemic response. They've operated under waivers that don't require eligibility determinations, or in many situations, we know that DC activities were not able to be conducted at the normal level since staff often didn't have access to their computers or records since they were not in the office. But as we move now to the current environment and hopefully move towards more of a traditional method of operating school lunch, DC again becomes a highly important and beneficial component of your child nutrition administration. So today I'm going to talk about some things to remember and some key points for both this year and for next school year. And I'll also be touching upon an exciting opportunity in the direct certification world, this being the expanded direct certification Medicaid demo project. So to start, first we're going to look at school year 2021-22 and look at the importance and remember what types of things to pay attention to as we wind down this school year. Next slide. So the first thing to consider, and this is probably well known by everybody on this webinar, is PEBT eligibility. In most places, your eligibility is being carried over from previous years, but there is still the need and requirement to be able to identify newly eligible individuals or students for PEBT eligibility. With the recent rise in Omicron variant and some schools that were previously in person, fully now going to some remote learning situations, the importance of this PEBT eligibility becomes becomes greater because kids are now going to be missing school lunch. So the easiest way to get that eligibility for these new kids is to consistently run your direct certification operations. This is going to be the easiest way to find these kids, upload them into your point of service systems as well as your student records to identify them for PEBT eligibility. Second, this is a great time to run your ISP calculation to have an increased ISP, or for those schools who are not yet on CEP, to be able to identify more kids, because your SNAP rolls due to the pandemic have increased. So you want to take advantage of these higher number of records that could be coming through to increase that ISP. I know Rob will be speaking more about this on the second half of this webinar. And being a state agency with state agency experience, Rob will have a lot to share in this area. Lastly, the last 2 years, we have unfortunately not been able to calculate a SNAP direct certification performance rate. In 1920, we did have the data, but we were not able to clean it because schools and state staff were not in person. So with the inability to clean it, we did not want to put out a SNAP performance rate that we were not be able to ensure the integrity and the accuracy. So we held out those figures. And then last year, of course, with the pandemic, we did not collect the FNS 834. So without the FNS 834, we were not able to calculate a SNAP DC performance rate for school year 2021. However, for school year 21-22, as schools are back in, and even though you may not be collecting applications and operating under waivers, we have moved forward and we are collecting the data to calculate a SNAP DC performance rate. We're collecting the FNS 834, which will give us the information for special provision schools, as well as the SNAP totals for the children who should be participating in school lunch. So we have those components, and then we will be collecting the 742, which will tell us the number of children directly certified. Even though, again, you may be operating underneath one of the waiver to not collecting applications, you still should be running your direct certification activities, and this will give us an idea about the performance of the state. Now, we understand that in a lot of situations, we're going to probably be seeing a decrease in the rate because schools may not be running direct certification with the same vigor. And we'll take that into consideration when we work with state agencies on their continuous improvement plan. This last round of the report to Congress, which was for reporting school year 18-19, we did receive the highest direct certification rate nationally, which is about 98%. And we had the most states meet the benchmark rate. So we are aware that we're probably going to see a little pullback from that. But again, we think it's very important after 2 years of not being able to get a gauge on where state agencies are, to collect that information and see if we do find any areas that we need to work on. So next slide. So for school year 22-23, next slide, we have some key things to remember and key points I want to make. So with the assumption, hopefully, that we are moving back to normal, we have a school operation where direct certification again becomes a very important component of your operations. The first thing you want to remember is to emphasize your direct certification training and update guidance. For a lot of staff, they may have not been fully involved in direct certification, utilizing user interfaces, doing potential matches. So those types of areas, you are going to want to go out and re-emphasize the importance of those components of the direct certification system. You most likely have a lot of turnover as well. So you'll be reintroducing or introducing the direct certification activities to many new people. So you want to really emphasize direct certification this year because for a lot of people, it's going to be their first go around with this activity. If you have guidance, make sure you go through your guidance, make sure it's up to date. Anything that needs to be done, you want to get that done prior to the beginning of school year 22-23 so that your both state staff and local staff have current and accurate information to refer to. Start your DC prior to your school starting. This again becomes very important in last year or this current school year that may not have been that big of an issue because again you were operating under a waiver, but now you want to make sure you get your DC done before your school starts so that you do not have to send out applications to families that are DC eligible. Work your unmatched records. This year, a lot of LEAs may not have been working the unmatched records as much as they had in the past because they may not have seen a need to. So emphasize those potential matches that are available in your system and go over with them in your DC training, the protocols and process to turn potential matches into actual matches where possible. And finally, for school year 22-23, the effectiveness of your direct certification matching process is really is gauged based upon the quality of your data. Over the last couple of years, there's a possibility that local level data for both student records and in their free reduced priced application modules or point of service systems may have become decreased in accuracy. So this would be a good time for all of your locals to go through, make sure that names are full legal names, people aren't using nicknames, make sure you have accurate date of births, do a good scrubbing over these next several months to make sure that the information that's being matched in, say, the state system is complete and accurate to give you the best recall and the best precision on a state agency's linkage method. All right, next slide. So now I'd like to move on to the direct certification, the demonstration projects to evaluate direct certification with Medicaid. Although the priority of direct certification with SNAP, TANF, foster care may have decreased a little bit in the minds of the local levels of importance, we've used kind of this time to push forward and reintroduce and reemphasize this opportunity to participate in the direct certification with Medicaid demo project. Next slide. So what is the demonstration project? So the demonstration project is evaluating the potential of direct certification Medicaid to identify free and reduced price kids for school meals but aren't currently certified, directly certified students who are currently enrolled in the meals programs based on an application, as well as assess the costs of participation if we were to move forward and match with Medicaid across the board. Next slide. So when you think about Medicaid for our purposes, we are looking at those children who are participating in Medicaid in a regular Medicaid or expanded Medicaid program. And that's going to include like the expansion of children's Medicaid eligibility under CHIP. It may include children who are enrolled in federally funded Medicaid only for treatment of an emergency medical condition if they satisfy other requirements and the state agency receives clearance from FNS. But it does not include those individuals who are participating in CHIP programs who are separate from the state's Medicaid program. Next slide. So who's the target universe of this demonstration project? So we're looking for children who either receive or they're living in households with another child who receives Medicaid. In this program, you can extend eligibility. And then the household has an income as measured by the Medicaid program before the applications of any of their disregards or expense-related block that does not exceed the NSLP demonstration income standards. Next slide. Okay, and those free and reduced price standards are the same as you currently operate under, and that's going to be for all households who are at 130 or below of the FPL. And then for reduced price, it'd be those households who are at 185 or under the FPL for the reduced price eligibility. Next slide. Okay, so I'm going to now kind of give you like a summary of the key policies of the demonstration project. Children who are participating or receiving direct certification eligibility through this demonstration project are ones who meet income standards. So there's no categorical eligibility afforded. So you may have some Medicaid categories where children, regardless of income, is eligible and there's no income testing. That is not a category that would be eligible for direct certification. They must be income eligible. The state agencies will do an automated matching, the same that you would do with the SNAP or TANF program, to identify those eligibility records directly with student records at the state level to identify those kids. And when I say state level, that could also be at a local level if you're having a local level initiated system. But we're looking at student enrollment records matching against Medicaid records that were determined to be included based on an income standard, the same way you would be matching SNAP records. Now, the LEA they cannot certify based upon a case number. You may remember the term, the SNAP letter method. You're not able to just simply turn in a Medicaid letter and become directly certified through that way. It must be through an electronic matching process. Next slide. So the other thing you have to remember is that students who are already certified for free reduced price meal on application or directly certification with another program cannot be negatively impacted. So you have to remember, unlike the other direct certification programs, Medicaid has both a free and reduced price category. So you have to ensure that if I was free by app or free by SNAP previously, if I come in on a reduced price income calculation, you have to ensure that you will not reduce my benefit level. I can only become meet the same status. And as well, the reduced price children, if you're directly certified through reduced price, cannot be included in your community eligibility provision ISP. And that's because the ISP for community eligibility provision is based upon free children only. Next slide. So the demonstration project, again, is trying to determine how many kids we find with direct certification that would otherwise not have been found through other means of direct certification. And that's why we have this chart, the hierarchy of direct certification. So as you can see, Medicaid is is the last in line on this. You need to go through all of the other direct certifications to then come up with the population who are identified for direct certification by no other program. So the priority is SNAP, the TANF, FTPI, or other, and then to Medicaid. And then when we're looking at state agencies and their systems and the local level systems, we're ensuring that we're not getting an identification of children who are certified on Medicaid who otherwise could have been directly certified on SNAP or TANF or any other program. Next slide. So currently, prior to this RFA, we had 19 states who were participating in an existing demonstration project. We had the 4 who were still remaining from the free pilot back in 12-13. And then we added the 15 states on the right 2 columns who free and reduced price in 16-17 and 17-18. And these states have been operating this for the last couple of years. And we've been taking evaluations and data from them to see the effectiveness and the cost of the program. If you are a state on this call and you're interested in talking to somebody, what their experiences were, these states provide a great reference. You can always reach out to me as well, and I can align you with some state agencies who have staff that are still there, who were involved within the process, and can tell you all about their implementation experience. Okay, next slide. And then here are the 8 states which have joined us. They were awarded, I believe it was December, our letters went out. So they applied for the program, sent in their applications, was in September of 21. We had 8 states apply, all 8 states were accepted. And we are currently working with these 8 states on status calls to gauge their readiness to begin their direct certification matching with Medicaid beginning hopefully on July 1st, 2022. Next slide. So in order to be to participate and to start matching, there are some components though that states have to meet. So even though their applications were accepted and we're moving forward, there are still several areas before a state can actually match. So if you are an advocate working with a state, please know that just because somebody is in the program, there is several steps that they have to move forward to in order to start matching for 22-23. We feel really confident based upon our first round of calls that everyone is going to be able to start on July 1st. We want everyone to be very early in that school year because that's the most benefit when you start your direct certification matching. We want everyone to be found that will be found, so that reduces that labor of those applications going out, and that child, when they come in on day 1 of school starting in late July, August, September, is going to be identified as a directly certified family. So what are we looking for? We're looking to make sure that the state partners have data sharing agreements in place. There should be protocols, identified types of data that's going to be shared, the frequency, what are the parameters of security of data, who's going to be handling the data. Because it is Medicaid data, there is a heightened sense of, this is someone's personal information associated with medical information. So all those things must be in place, signed, executed before someone can go live with their sharing of information and matching with the local level. We're going to want to make sure the testing has been completed. I talked about the hierarchy. The last thing we want is a system going live that is overriding a free buy app with a Medicaid reduced price. So we are going to be looking at all the testing protocols and the testing scripts to make sure that state agencies and their partners and their contractors and vendors, as well as their local level point of service systems, are ready to go and will be identifying children correctly and not erroneously reducing benefit levels. We're talking about the matching process and mechanisms. any change in algorithms. To date, it looks like no one will have to be changing their coding and algorithms. So that means that that's one step that doesn't have to be done, and it allows people to move, forward faster because their current matching protocols are going to work for Medicaid. Um, Training, obviously, we want to see training as a component. Um, you want to make sure that because you may be changing your user interfaces, that you have worked with some local level representatives to look at your user interface, to conduct UAT, to make sure that when the schools get this information from your system, that they understand it, they understand the layout, that they know when they see an R or an RP, on a code, that they know how they're supposed to handle that. And then the ability to report data for the evaluation study. Important to this program is an evaluation study so that we're able to see what the effects are of both the number of children that we reach and then the cost of the program, on that side. So there are certain types of data that have to come to us, that have to be able to be reported, and we're going to ensure that prior to entering and going live for school year 22-23, that these state agencies are able to do this. An important thing to note with these 8 states that have joined, we now have a total of 27. And given some of the states that we have with, Texas and California, some of the larger states, with current numbers, we're looking at actually covering about 75% of the population for a national school lunch program. So that's really impressive because from both a efficiency standpoint and then a standpoint of able to reach a population that can be eligible for direct certifications. Next slide. The evaluation study, as I mentioned, the third study for the first round of the free and reduced price is currently in clearance, and that's going to be going up soon, hopefully, for public consumption and viewing. Next slide. And then the last thing I want to mention is that, again, for those of you who have looked at this RFA, it is an RFA that has multiple opportunities. We did not want to put everybody into a single category. With the pandemic, people are extremely busy. And we did not want to deter from those state agencies who were interested, but they just did not believe they could join on this year. So we have another opportunity that's going to be for beginning school year 23-24. We will have an RFA webinar for state agencies, probably again in the month of July, and that'll be coming up soon. Applications are scheduled based upon the RFA to be due on September 30th of 2022. And then again, the start date would hopefully be July 1st of 23. And that would be again for beginning school year 23-24. If you are interested in the happenings of Medicaid demonstration, the RFA and all other applicable information, documents, announcements of the states that have joined is available up on our website. I have the address there, but it's also just as easy to simply search FNS Direct Certification Medicaid Demonstration, and it should pop up as your first result, hopefully. So that's the end of my presentation, and I can kick it back over to Allison.
Thank you so much, Joe. Now I'd like to introduce our second speaker, Robert Leschen, who is the director of the Office for Food and Nutrition Programs at the Massachusetts Department of Elementary and Secondary Education. The floor is yours, Rob.
Allison, and thanks, Joe, for that background information and the USDA's perspective. So, in terms of direct certification, quite frankly, I guess it's my personal opinion. It's quite frankly the most important aspect of the USDA child nutrition programs. Not only does it provide efficient, much easier and quicker way to certify students for free price meals in terms of the level of effort school food authorities, and the potential to make it seamless for households in terms of eligibility. It's it also cascades into so many different other programs. The higher your free and reduced price numbers based on properly identifying those students within your district, the ability to qualify for other programs such as the fresh fruit and vegetable program, the summer food service program, um, which is based on free and reduced price eligibility numbers, family daycare tiering, and of course community eligibility. So it's really important. Um, in terms of frequency and whatnot, we work with school districts in Massachusetts to ensure that they understand to run direct certification very frequently. The regulations state that districts should do it at least 3 times a
Oh,
year.
Rob, one moment. Can you just speak up a little bit and a little closer to your mic? We're having a little bit of trouble hearing you.
Okay, can you hear me now?
Keep speaking.
Hear me now?
That sounds good.
Okay, sorry about that. So it's really important to run direct certification and to run it frequently to ensure that you're catching people. In terms of in Massachusetts, roughly 90% of kids that are certified for free and reduced price meals are directly certified for free and reduced price meals. So interestingly enough, when it comes time in Massachusetts that we have to reestablish eligibility, based on the last couple of years being all the students free. Hopefully we should be able to do that in conjunction with school districts fairly easily once everyone has started to conduct direct certification. Go to the next slide, please. So in terms of right now, even though meals are currently free, I certainly would suggest to continue to run direct certification frequently. And Joe touched on some of these points. But first and foremost, the pandemic EBT eligibility for states that are approved for it for this school year, or those states that are seeking approval with USDA. One pathway to qualify to be eligible for pandemic EBT, of course, is direct certification. So school districts should continue to run direct certification this school year and should have been doing it last year as well. To ensure that pathway to PEBT eligibility is available. We've also been talking to school districts this past 2 years about the 30-day carryover period. If you directly certify a child for free reduced price meals today, even though meals are free and will continue to be free through June 30th, that student will be established officially on record as directly certified this school year. And will be eligible for at least that 30-day carryover period next year, assuming if the waivers end and the universal free meals waiver is not continued. School districts, including those that are CEP districts, community eligibility provision districts, are also required to do FNS 742 reporting of the status of its data report of those that are of students that are directly certified by way of direct certification or certified by way of paper application and results of the verification process. That is required, which is one of the reasons why school districts that are approved for community eligibility where meals are free must continue to run direct cert. And importantly, we've worked with school districts over the last 2 years while meals are free to continue to run frequent direct certification, specifically to build the number of identified students for community eligibility. Go to the next slide, please. So community eligibility, for everyone on this call, I'm sure you know what it is. It certainly is the best option to continue free breakfast and lunch, assuming the waivers come to an end, and they will come to an end at some point, we assume. And so we have been working with school districts throughout the last couple of years to continue to run direct certification as clarified throughout the pandemic and allowed by USDA to work with the state agency to establish new or reestablish identified student percentages, which are the number of students directly certified or categorically eligible for free meals. And that the higher those percentages are, the higher levels of reimbursement a school district could get for providing free breakfast and lunch. We've been working with school districts, those that are already in CEP and those that are nearly eligible for CEP, to continue to look at their numbers, run direct cert, and work with us to establish these identified student percentages. Reasons why is because there's a high probability that food insecurity levels persist in the school districts, and the number of households eligible for SNAP remains high. So we sort of liken the CEP approval process as sort of locking in on interest rates for their mortgage. You want to lock in when interest rates are low. You want to lock into CEP when identified student numbers are high. That will help defray costs and ensure that you're receiving the maximum amount of federal reimbursement that you can. In addition to the direct cert side of it, we've been working with our SNAP agency very frequently over the last 2 years or so, or a year and a half when pandemic EBT started, on promoting SNAP for households who have received PEBT but are not on SNAP. We've sort of identified a new SNAP gap, sort of the PEBT SNAP gap. Those that are receiving pandemic EBT but are not on SNAP. Some of these households may or may not qualify for SNAP, but they are certainly in high need areas based on the definition, either if they qualify themselves as a household or if they're an existing student that's not directly certified for meals but attends a CEP school. So we've been working with our anti-hunger and outreach partners and advocate groups within Massachusetts to find the best ways for outreach material, social media, graphics, etc., to promote SNAP, sort of more money with SNAP for those that are receiving PEBT but are not on SNAP. And the reasons are obvious. Number one, for the household, so that they can have continued, so we can sort of avoid as best as possible a potential benefit cliff coming down the pike. And they can continue to receive cash assistance for food based on eligibility, plus also the inherent benefit for a school district to incorporate new and more households that are eligible for SNAP and match them properly through direct certification. Next slide, please. And lastly, I'll talk a little bit about our experience in the direct certification with Medicaid demonstration process. As previously indicated, Massachusetts was a part of the original 7 pilot states in 2012 to directly certify kids for free meals using Medicaid data. We were approved to directly certify students for reduced price meals back in 2017, the spring of 2017. And a lot of the work that we've done with the Medicaid demonstration, first and foremost, the Office of Food and Nutrition Programs, the office that administers 12 child and USDA food distribution programs, we reside in the education department. So we have to work, especially with this Medicaid demonstration, as well as direct certification as a whole, in terms of best practice, ensuring that state agencies have a very good relationship with your Health and Human Services Secretariat, where most likely most of these benefit programs reside. And Medicaid, it's been our experience, is quite complicated in a lot of different categories. So certainly establishing a good relationship with your state Medicaid office is critical for it to be a success. We do frequent check-ins, generally speaking, with our HHS Secretariat, particularly our SNAP agency, but also Medicaid as well, to continually stay on top of any changing categories or eligibility coming out of the Medicaid world and things like that, to ensure that we have a good process in place. It was easier for us, I guess, moving into the reduced price because we've already had the established relationship, data exchange, MOU agreements, and all of that already in place. We already built a utility where we could toggle the free and reduced price, the federal poverty levels, the FPLs, to increase it to 185 and lower it to 130 based on the chart that Joe showed earlier. So we were in an excellent position to be able to move into and include reduced price in addition to the free direct serve process. In terms of direct certification, generally speaking, we've worked for all these years to continually improve direct certification, not just the algorithms and the matching process itself, but also the end user process, and working with school nutrition directors and school business officials, student information management folks in the district level, to gather feedback from their experience, making sure that that the process is efficient, is easy. The results are in a format that is needed on their end to learn more about point of sale systems, POS systems, and data that they need, data that they would need for 742 reporting, et cetera. We have an online direct certification process. It's 24-hour ad hoc. It could be accessed at any point 7 days a week. So that's why we encourage frequent direct certification running. And we also, in terms of the matching process, we moved over the years. I think it was about 3-4 years ago. I guess with the pandemic, you sort of have to add 2 years when you're recalling. So probably about 3-4 years ago, we moved over to a probabilistic matching process. I don't have time nor the expertise to explain the probabilistic matching logic and algorithms, but what it does is not only uses state-assigned ID numbers, which we call SACID numbers, but also uses a sort of probabilistic scoring mechanism which very much improved our matching capabilities. And lastly, one of the bigger reasons to ensure that the direct certification process is run continuously at the school district level, but also at the state level, that the process is improved continually year after year, and in maximizing direct certification, not just for the child nutrition programs, for households access to free meals, and not just because of allowing potential cascading new opportunities for school districts or child nutrition sponsors to be eligible for other child nutrition programs like area eligibility and the summer meal program, fresh fruit and vegetable, et cetera, but also identifying low-income students. In Massachusetts, because of the growth in community eligibility, where paper applications were no longer being used in approximately 100 school districts in Massachusetts, we lost, over a period of that time, we lost the ability to calculate low income, which, at least in Massachusetts, and I believe in most states, historically have always used paper applications. So since fiscal year 2017 in Massachusetts, the low income metric for student purposes has been, the direct certification process has been fully relied upon to come up with that number. So it is vitally important that the direct cert process, and especially the system and the algorithms, can maximize as much as possible. So it was a no-brainer to jump into the Medicaid demonstration. It was a no-brainer to jump into the ability to do reduced price as well, to ensure that we are properly matching and catching as many kids and households that are, in every definition, low income, to ensure that Title I funding, state education funding that is relying upon these numbers are as accurate as possible. So I will kick it back over to Allison.
Thank you, Rob. Next slide. Before we go into questions, I wanted to touch briefly on a couple of resources FRAC has available on our website with tips and best practices on direct certification. First is our fact sheet on the Medicaid direct certification demonstration project call for proposals, followed by our school district strategies for improving direct certification, and our resource direct certification improves low-income student access to school meals, a guide to direct certification. And you can find all of these resources and more at frac.org. Next slide. And at this time, we will start our question and answer session with the audience. If you have not done so already, please feel free to use the Q&A function at the bottom of the window to send us your questions. And I will start off. We have some questions that have been left for us in the chat. And the first is a question about missing a lot of kids on direct certification matching due to different last names, different addresses, etc. And if either of you had any expertise or advice on how to deal with that.
Yeah, well, I can start. So the first thing for most systems, their address matching or address components is not being used, or if it is being used, it's going to be de-emphasized. And the reason being is that we simply know that address data is often of poor quality, and a lot of families are mobile. And if you don't have address standardization, where you have difference between street and ST, or if you're missing apartment numbers, then that can create havoc within a linkage method. For last names, you know, data quality, as I said earlier, is with updating your student information is one of the most important things. When you look at the importance, like the accuracy of the data. So when you look at differences in first names or last names, what we teach is to apply probabilities, the ability to look at last names and not necessarily require a pure exactness, and by doing so, eliminating a match. So you may look at William and Williams and be able to provide partial credit for that, to be able to move forward a match that has two records which have the same first name, same last name, but have a very small variation, like say in the last name. So what it really comes down to is to looking at ways to be able to utilize the data you have to understand data quality areas you have, and to apply those kind of algorithmic tools within a system in order to return those matches. But at the same point, you need to balance that with the potential to get false positives, because what you also do not want is you do not want to lower your level of precision so that you're returning a lot of linked records which actually aren't the same kid. So there are a lot of things you can do. I'd say the biggest advancement, and Robert could probably talk about this, is that I've seen a move from simple deterministic first name, last name, date of birth, exact matching, to incorporating various algorithmic tools to allow for data quality or fat fingering, typos within data, and be able to still link records. So it is greatly improved over the last several years.
Yeah, and I can add, I guess, from the state agency perspective, years ago, prior to moving to this probabilistic matching process, we ran into issues in working with school districts about reconciling partial matches and the different surnames and juniors and Robert and Rob, Bobby, and all of that. And it was getting better, and we were tweaking what Joe was talking as the deterministic matching, which is sort of just crude matching of last names, first name, last name, date of birth, etc. And when we moved over to this probabilistic matching, we got rid of partial matches as a concept. School nutrition directors no longer had to reconcile partial matches. And I guess for the program operators, the school nutrition directors, et cetera, that are on the call, unfortunately, you guys can't do much about that. This is more to, I suppose, state agencies, or you can reach out to your state agency. And what we did is we worked closely with our Health and Human Services Secretariat, EHS, and they have an office called Master Database Management, MDM. And they were the ones that were able to utilize this probabilistic matching algorithm, and we basically shelved and scrapped the old deterministic process, and this not only improved our matching results, but also improved and made much more efficient the end user experience in terms of not having to do partial matching, et cetera. And it's been good so far. So I guess reach out to your state agency or any state agencies on the line. Feel free to contact me, I guess, in Massachusetts, and happy to help and explain further our experience.
Yeah, and then I'd like to apologize. It's the question is an awesome question, and it's a several-hour discussion, and I get very excited when someone asks me about like algorithms and linkage methods, because there is a varying array of ways to improve, and even if you're looking at a deterministic matching, there are a lot of positives that you can have with that as far as like going through multiple passes. What I would refer you to is the last report to Congress that went up. There is in the second half of that, there is an area. The second part is the best practices, and that best practices, which I wrote, is all about best practices in linking records. And you can go through several of the high performing states and see how they're linking records, the way they do it, their best practices, and what they found. So if you just read, if you go and refer to that, I think you'll get a really good background in what types of high performance, high recall, high precision systems are out there, who's using them, and the tactics that they're using to find more kids.
That's great. Thanks to both of you. And Joe, a couple quick questions. First, do you think you could send that report to me so that I can
Yeah,
then send it to everyone else along with the other materials and follow-up?
yeah, I'll send you the PDF and the link.
Awesome. And then another quick question that we got in the chat is if you could clarify what the acronyms SIS and POS are.
Oh, I'm sorry. So SIS is Student Information System. So that's going to be a state's database of student records. Usually there is an SIS, Student Information System, at the local level, and then there is one at the state level. Sometimes they are interconnected. They may have the same vendor with which you have a state occurrence. Like a Power School, Infinite Campus are two of the big names. And that's just basically a state's way of tracking those students. And those are the systems that they use, which is the enrollment, to match against the benefit records that come in from their DHHS or their SNAP agencies to find these kids for direct certification. POS is point of service, or free reduced price modules. It can be interchangeable. That's the child nutrition, the school lunch, director system for tracking those kids and the kids that are getting free lunch and, paid lunch and paid. And that's where the records are going to be kept of who is directly certified. So that's what the POS system is. Rob, you all may call it like free reduced price module, free reduced price systems.
Excellent. Thank you so much. And we have time for one more question. And this is a question about direct certification and with siblings. So if you have one student in a household that is directly certified, will all of the students in that household, or such siblings and other students living in that household, be directly certified as well?
So that's going to depend on the program, because not all programs extend eligibility. For SNAP, TANF, FDPIR, and for Medicaid, eligibility is extended. Several states have mechanisms or tools within their state direct certification user modules, which provide the LAA with an added feature for extended eligibility. I'll let Rob talk about extended eligibility in his state if they may have like some tools that they use.
Yeah, in our system, we built up process to do household matches, we call it. So there's two ways: either if the system can household match based on student information that's uploaded into the direct certification system from the district level. We also have a process for school districts to be able to identify households based on the USDA household, or household members rather, based on the USDA definition of household. As a proper record documentation for administrative review, those students extended.
Yeah, and I would say generally another improvement that we've seen is both at in-house built systems and with the COX, which is commercially available off the shelf systems, is these added tools to link children. So if Joe Templin lives at 100 Main Street in Chicago, Illinois, and I'm identified as direct certification, what the system's going to do, it's going to query for anybody else who is living at 100 Main Street in Chicago who may not be directly certified. And then they're going to offer those unmatched records to the LEA for the LEA to look at and say, oh, yeah, Rob is his brother. For some reason, they didn't match, possibly a data quality error on the SNAP side. So I'm going to go in on the user interface, I'm going to check a box, and I'm going to link them, and then I'll be able to download those as a record match. So that is one area of functionality which has really increased the effectiveness of the direct certification performance rate. And for even those states that don't have that functionality, most of the point of service systems, the free reduced price modules that the locals use will also have something which will look for students within their enrollment who are matched against, by address or even telephone number, since telephone numbers are now, they're with mobile numbers, you can move around with the same number. They're going to look for kids who are matched, who have matches in other secondary data attributes, which is like addresses and phone numbers or guardian name, and say, hey, it's Joe and Rob. Joe's matched. He's directly certified. Rob's got the same address. Do you want to extend eligibility? So that has been a very, very big improvement and advancement, in which is one of the reasons why we're seeing direct certification rates go up.
Excellent. So we're coming up on time. So I'm going to go ahead and wrap up today's webinar. Thanks to all of you for joining us today, and a very special thank you to Joseph and Robert for joining us and sharing your experience and expertise. The recording and all resources mentioned will be shared in a follow-up email. And in the meantime, please don't hesitate to reach out to us if you have any questions. Thanks so much for joining us, and we'll talk to you soon.